Assalamu alaikum. Let's talk about acute cervicitis. Acute cervicitis, it may be infectious or it may be non-infectious. Infectious is chlamydia and gonorrhea. Non-infectious is foreign object latex dowsing. Foreign objects latex dowsing. Clinical presentation asymptomatic mucopurulent discharge. Postcoital or intermenstrual bleeding. Postcoital or intermenstrual bleeding. Travel cervix. Asymptomatic mucopurulent discharge, postcoital or intermenstrual bleeding, and friable cervix. Evaluation is nucleic acid amplification testing and wet mount microscopy. Management empiric treatment is ceftriaxone with doxycycline, and in pregnancy ceftriaxone with azithromycin. What is the likely diagnosis in a sexually active woman presents with sexually active woman post-coital bleeding, mucopurulent discharge, this type of discharge, post-coital bleeding, and with a friable cervix on the pelvic examination? It is acute cervicitis. Acute cervicitis list common symptoms include dysuria, dyspareunia, and vulvovaginal pruritus. Dysuria, dyspareunia, and vulvovaginal pruritus. Pregnant patients with cervicitis often have no cervical motion tenderness, a sign of upper reproductive tract infection, a sign of ascending upper reproductive tract infection because the gravity uterus is sealed from the reproductive tract to maintain uterine sterility via mucus plug. Fever is an important differential of PID, and which will have fever. In PID there may be fever, and in cervicitis there is no fever. So we can differentiate from PID from the cervicitis. And what is the most likely diagnosis in a patient who presents with third trimester with pelvic pain? Uh, with pelvic pain, she says that she recently began have sex, and examination shows cervical bruising and tenderness with no signs of active bleeding. It is cervical trauma. Cervix becomes hypervascular during pregnancy. Cervix becomes hypervascular during pregnancy. So in case of cervicitis, if you want to prevent the cervicitis, barrier contraception like condoms is the primary prevention, and periodic screening should be done for chlamydia and gonorrhea. In case of sexually active woman age less than 25, annual screening should be done. High risk sexually active woman more than 25 or more than 25, annual screening should be done. And pregnancy age less than 25 or high risk individuals age more than 25, first and third trimester screening. So that is all about acute cervicitis. Hope you enjoyed.